In the midst of deliberations on how to allocate the 500 billion naira palliative fund among all states, the Health Sector Reform Coalition is urging Nigerian federal government to direct the entire funding towards expanding health insurance coverage. The coalition believes that this strategy allocation will play a crucial role in achieving universal health coverage across the country. Their call to prioritize health sector is to address the poor coverage in health insurance across Nigeria, which according to statistics has less than 18 million Nigerians, approximately 8.5% of the population, have been enrolled in any health insurance scheme, leaving a huge number enrolled.
The 500 billion naira palliative, which was promised by the federal government to mitigate the impact of subsidy removal, has sparked a wave of debate and demands from various sectors in Nigeria. As different sectors vie for a significant portion of the palliative, the Health Sector Reform Coalition has advocated for the entire funding to be allocated towards expanding health insurance coverage. At a press conference in Abuja, the coalition argued that the 500 billion naira palliative funds present a unique opportunity to transform the health sector and bring us closer to achieving universal health coverage.
We implore Mr. President Asiwaju Ahmed Bola Tinubu to use at least 500 billion naira from the funds earmarked for providing palliative to cushion the harsh effects of the removal of the petrol subsidy, to provide health insurance coverage to at least 30 million vulnerable Nigerians in the next 12 months, in addition to other measures. This is realistic, given the rate of 15,000 naira per person per year. That's the insurance. The sum of 450 billion naira will cover for the health insurance of 30 million vulnerable Nigerians. This additional 30 million lives will increase the insurance coverage of about 18 million or 8.5% of the population.
While various sectors, groups and coalitions have raised their voices in demanding a portion of the palliative funds, the question pledging for answer is, why the health sector?
Health is at the middle of every other thing. When health insurance is available, more people, you are more relaxed. You know that you can walk into a hospital and your needs are attended to. Health insurance covers a number of things. It covers your dentition, it covers your eyes. So it's not only when you have malaria, right? It covers a lot of things. And we're saying, let's start with that.
Give 30 million Nigerians, vulnerable Nigerians, the opportunity to live. The oil subsidy removal is killing Nigerians. Take the money so that at least their health will not be compromised also.
Addressing the concerns surrounding the social register and the identification of vulnerable groups, the Health Sector Reform Coalition proposed that the current register undergo cleaning and amendments.
If there are challenges with the existing register, we have to correct it since we've identified the challenges so that we can move forward. A month or two, we can correct those flaws. Ask yourself, can Nigerians wait for another 6 months? Look at the dire stress already. So I will suggest, or we are suggesting, clean out the existing register instead of starting a new register afresh.
They also made a key recommendation that the provisions be paid into a federation account to ensure proper oversight and equitable distribution of funds among various states.
We are not reducing the out-of-pocket expenditure. 70% of the amount spent in health in Nigeria is spent from out of the pocket. So every person is one disease away from poverty. The remaining 92 or 93% pay from their pocket, and that is serious. What does that mean? It means that when you are sick, you will forget about school fees, you will forget about buying food, you forget about buying clothes. You will recover the life of the person first.
Key recommendation today is that we should fund this money for the federation account. The federation account is money that belongs to both federal, state, and local government. instead of focusing on the federal government's account only. And federal government is paying its share, and the states and others are not paying. So if we take this money out of the federation account, there is no need for the state to be paying counterpart funding. Even the administration of collecting the counterpart funding will become a non-issue.
Nigeria, as a diverse and multi-sectorial nation, has witnessed numerous demands from different sectors seeking their share of the palliative funds.